Today we're talking about how to read an operative report and pathology report. The operative report usually have pre-op diagnosis, post-op diagnosis, procedures, anesthesia, or a surgeon, assistant surgeon, anesthesia, complications, blood loss. Usually a findings section, not always, where they kind of summarize what they found. Procedure in detail. This is the actual body where the surgeon dictates or says what was done during surgery. And if we don't have photographs or video, this is it. Then the pathology, we have the specimens, gross description, basically what did it look like visually, and then microscopic diagnosis. So let's go through it here. So you can see she had a left adnexa ovarian tubes, mass, preoperative, post-op diagnosis, endometrioma, pelvic endometriosis. And then the procedures were operative laparoscopy, left cystectomy, excision of endometriosis, and chromotubation, which means putting dye through the tube. So one would assume from this procedure that was dictated that this patient had an excision of endometriosis, but I'll show you why this actually is very misleading and deceiving in what this is. So under findings, we had laparoscopically, patient was noted to have an enlarged left ovary. Endometriosis was noted on the bladder flap anteriorly and to the left as well. Not really clear on what to left as well is. And then in posterior cul-de-sac. And again, the posterior cul-de-sac is most of the pelvis. It includes the area behind the uterus, behind the cervix, behind the vagina, under the ovary on both the left and right side, over the rectum, next to the rectum on both sides. So really this is very vague and inadequate in the description of what's being done. Then down in the procedure in detail, we can see that when they got in, noted to have a 5 to 6 centimeter left ovary adherent to the left ovarian fossa, also known as the left pelvic sidewall, and those adhesions are almost always endometriosis. The patient was known to have endometriotic implants along the left anterior bladder flap as well, and in the deep posterior cul-de-sac. Again, we got an area roughly a foot in diameter that we want to know where the endometriosis was in detail. At this point, assistant helped me elevate the ovary, free up adhesions from the ovarian fossa. They used the graspers to grasp the cyst wall and dissect it from the ovary itself. The chocolate fluid was drained, the wall was removed and sent to pathology, which, I mean, this sounds relatively appropriate as far as removing the cyst wall. You have to peel them out. And then down here you can see the ovarian implants over the bladder flap were fulgurated using electrocautery. Wait a minute, they're burn-in surgery and they said they did excision? One of the endometriotic implants were removed using the monopolar scissors and sent to pathology. So they're saying they excised one of the implants, and then the remaining implants were fulgurated using electrocautery. Again, so they're doing burning surgery, but they say they're doing excision surgery. Quite misleading. And then, but let's see, what did they excise? So they submitted 2 specimens, a left endometrioma cyst wall and a left pelvic peritoneal side wall. Okay, that tells us a little bit more. They took the biopsy from up under the ovary. And again, if the ovary was stuck there, then we have probably a couple centimeters of endometriosis in there. Gross description, again, they describe endometrioma cyst wall 4 by 2.3 by 0.8 centimeters. Again, 2.5 centimeters is an inch, so we have roughly 1.5 by inch by third of an inch, which that's okay. It's maybe a little small for an endometrioma that big, but I guess we have to assume they got it all. And then left pelvic sidewall peritoneum, and let's look. So the size of the tissue, 0.7 by 0.4 by 0.3, or that's 7 millimeters by 4 millimeters by 3 millimeters. So again, 25 millimeters is an inch. So what we have is a biopsy about 1/8 of an inch by 1/4 of an inch by maybe half an inch. No, not half an inch. It's like a third of an inch. So it very, very small. So this is a biopsy. This arguably is not excision. I guess they did cut it out, but certainly not wide excision. And for all the endometriosis was there, not described very well, it seems that they actually did more properly would be the burning surgery, the coagulation. I doubt they did fulguration. It's a technical difference, but anyway. So really, they had burning surgery, coagulation surgery, and they did a biopsy. You know, a 3 by 4 by 7 millimeter piece of tissue is a biopsy. I would argue not excision. So if you know how to read your op report and pathology report, you see if this patient was told she had excision of her endometriosis, it was misleading at best. She really had the coagulation surgery with a biopsy to confirm the endometriosis, which on the microscopic they did confirm endometrioma and endometriosis. But I think you can see, I'm seeing more of these, which I would call microexcision with coagulation of surgery. So I want you to be educated so you can read through your op report and pathology report and confirm that proper wide excision was done. Because a wide excision biopsy usually be anywhere from 2 to 4 centimeters by 2 to 4 centimeters by like half a centimeter if it's just the thickness of the peritoneum. So if you're not getting much larger specimens than this, you did not get wide excision surgery. Alrighty, hope it's been helpful. Let me know what you think. Look over your op reports and give us all feedback of what you're finding out when you're reading through them like this. Alrighty, take care.